There are many different types of hair growth treatments that we can offer, but I offer three major types. One is called platelet-rich plasma. This is where we take your blood, spin the blood in the centrifuge and take the plasma out, and then we would inject it back into the scalp. And that has got a lot of growth factors and stem cells. It regenerates the hair cells to grow new hair. The other one is called exosomes. These exosomes are chemical messengers which will stimulate the growth factors and the stem cells, and we would put the exosome into the scalp with this gun, which is a cold gun. So it doesn't require blood and it doesn't depend on your quality of the blood. The other thing we can do is we can take your DNA, send it to the lab, and we can actually formulate a personalized tonic. In an initial consultation regarding hair loss, we would ask the client what is bothering them, how long has it been bothering them, because the hair loss can have different effect on somebody, and the pattern of hair loss is different as well. So we look at the texture of the hair, nature of the hair loss, their diet, their lifestyle, their medical problems, medication. So a hair loss consultation is actually a doctor consultation where the whole of your holistic health situation would be consulted. So the initial consultation for a hair loss will take up to about 40 minutes. There are different types of treatments, and we do decide a few different factors. Like for a young person, I might just advise a platelet-rich plasma because their blood is relatively disease-free, they are still young, they will have a lot of growth factors and stem cells in their blood. Platelet-rich plasma is a little bit cheaper as well. For an older person who has got medical problems, if they are on a lot of medication, I would advise them to use the exosome because their plasma level may not be as good. And a lot of other things would involve as well. I would advise people to take personalized supplements, personalized toners, and I would want them to follow the advice. So there are different general factors that are included in somebody's hair growth. Hair loss treatments, the ones that I offer, targets at the hair cells and the hair follicles basically. So those hair follicles, you need some hair follicles left for a hair treatment to work. If you have all the hair follicles already died, we may not be able to stimulate it. So we stimulate them by using a platelet-rich plasma or the exosomes, and they would regenerate the hair cells and ask them to walk as if they are young again. So the new hair will come out, the new hair will be a little bit stronger, it will grow straighter, it will give you a little bit more volume, it can have the old color back rather than graying, it will make the hair thicker and fuller. It takes about 3 treatments for all of the hair treatments, platelet-rich plasma or exosome, to work. And it usually takes at least about 6 weeks for 3 treatments to start seeing some sort of result. Hair growth treatments not only offer the aesthetic results as in your hair has grown again, it does improve someone's quality of life a lot. People tend to shy away from social functions, or they don't go out because they worry about their hair, because they have to spend so much time on their hair. That will improve dramatically if you help somebody grow their hair back. They will be able to go out more, their mental health will improve more, their physical health will improve more, they will enjoy life more, their quality of life will be a lot better.